Hello, I'm Louise. I'm here today with Ken to talk about chronic kidney disease. Ken is currently on dialysis, and I have questions to ask him about his experience. So Ken, how did you first find out you had reduced kidney function?
First found out because I was getting sick a lot, and they noticed that there was like a trend getting, everything was getting worse. My blood pressure was this above in the 200s. My diabetes was this out of control, and every time I would end up in the ER because of my blood pressure being so high, I would tend to pass out at home. So my wife used to take me to the ER, and then they would tell me the same thing. They would give me meds for it, or I would get admitted, and they would do more tests, and a lot of the tests were leading to, you go through the urinary tract infection, and then after that you find out, oh boom, my kidneys is infected.
Oh.
Then, that was pretty much the symptoms when they found out that I need to see a nephrologist as soon as I could.
So did you have any symptoms when you had the high blood pressure episodes, or did you just pass out?
Sometimes I would pass out, not thinking that it would be leading to my kidneys. I didn't even think about it. I was just thinking like, I should, pay attention to the foods I'm eating, but, not even that was helping at the time. Just that a lot of medication was involved, and at the time I wasn't noticing that. I was just not so I was just so affected by what was going on presently that I wasn't thinking about that it would be a kidney problem at the time.
Sure, it's not top of mind.
Yeah, it wasn't the top of mind, exactly. I was so worried about, watching everything else that, the kidneys was the last thing on my mind.
So you were referred to a nephrologist?
Yes.
By the ER?
By my PCP.
Okay.
By my regular doctor, which they're all part of the Castle group that I see.
So how did that first visit to the nephrologist go?
For me, it was kind of scary because I was, I didn't want to believe that there's a chance I might be on the dialysis machine, I didn't want to believe it. And he was like, no, you need to, get me, I need to see you more often. We need to control this. And then he wanted me to take all these classes, these information classes about, having kidney disease and what to be aware of, and what to there's what you got to expect it. If you're already in that realm of your kidneys are damaged, then you have to be aware of what's to come. So he was just trying to plan me ahead for the what's to come.
So with the diabetes, you were already watching your diet closely, so this added on to that.
I believe
right?
so. I believe that the diabetes is what caused the major damage to my kidneys. That and the blood pressure as well. But I think, being diabetic for so long that the damage was done, So, yeah, I believe strongly that the diabetes is also what's, the cause of many kidney patients now.
Yeah, I think that's true.
So
you keep getting sick, you keep going to the emergency room, you go to the nephrologist, and he says, get ready, you got a lot coming your way.
Yes, exactly.
So what was your response to all of that? That's pretty heavy news.
At first, I was shocked because all the medication that I had to take, 2 for my blood pressure, maybe another 2 for my diabetes, another one for my kidneys. So there's like a total of like maybe 8 to 10 pills that I was taking, and that's only in one sitting. It's not throughout the day, So throughout the day, medication was always part of my routine of getting up. Before I go to work, I need to take my medication. Even checking my diabetes as far as blood sugar, watching my range. So there was a lot, and I was kind of like overwhelmed by it because of the routine I had to do every day. You know, 3
there's
times
no
a day.
break.
Yeah, there is no break from, you know, this serious illness. Yeah, there is none.
Yeah. So I know in my case, and a lot of people I've talked to, we were in denial. We've all been in denial for a certain amount of time. Is that true for you?
Oh yeah, I was in denial when I first saw my nephrologist, and you know, I told him I don't want to be on the machine. I told him, you know, straight up, and he said, well, you know, you got to do this, this, and this. You got to cut this out. You got to take your medication, and so this went on for a couple of years, and I was just like totally just didn't want to do it. You know, sometimes I would like, you know, go into this depression of not eating because I was so worried about what I'm eating is gonna make something jump or make it worse. And so yeah, so it went on for a while, and then it kind of calmed down. After a while, it calmed down because what I was doing, you know, my health was a big thing for me. So I was really trying to. It calmed down for a while, and then my thing was for that to calm down. I think, oh, you know, maybe I should try. My doctor suggested that my PCP. He suggested to do the bariatric surgery.
Oh, really?
Yeah.
Okay.
He said maybe if you do this, you know, everything might go away. You have a good chance of everything going away. So I did that. Regardless of the situation with my kidneys, I pushed forward through that. And then, you know, over the like 6 months after I was in the program, I had the surgery done. And then everything was all fine. It was great. You know, I went through the process of doing that program. I lost the weight. I lost over 200 pounds during that.
Wow.
So I was a lot bigger, and then, you know, my symptoms, but a lot of my symptoms went away at the time, but not the damage to my kidneys. So when I got sick again, my wife was like, you know, we got to go, you know, because I kept passing out for no reason. You know, I can be talking to her and then I just pass out. So they found out that, you know, my kidneys was already at maybe coming to a stage 4. And I was like, oh, what am I did wrong? You know, I thought by, you know, eating healthy and doing the surgery that it would help. It did help, but it was just a little too late. So other than that, yeah, my first response was like, no, you know, why, I couldn't. I was in denial from day one. So yeah, denial was very much strong at the time from day one.
Yeah, it takes a while. So you said your nephrologist gave you a lot of information about diet, and your PCP recommended the bariatric surgery.
Yes.
Were there other things offered to you from your doctors to help you with general health?
General health, I think, because I was seeing him maybe once every 3 weeks. I was seeing him, you know. So yeah, it was a constant. They was monitoring me
Very
like
closely.
really closely because he was so afraid that, you know, I might, because I could stroke out because my blood pressure was so high. So then I didn't want that to happen, you know. But my nephrologist, he was very involved with me as far as a patient. He would, you know, we would have conversations. Like I would go and see him last. I wanted to be his last patient of the day, so I could get a lot of information out of him and what he recommended for me. So he had recommended this, like, you know, keep doing what you're doing. This, you know, be aware of what you put in your mouth as well as what you drink. Be aware of it, and this, you know, try and jot it down what you eat throughout the day, and then when you come see me again, then show it to me. So he wanted me to watch my diet. Like he wanted to see what I was eating and drinking. So yeah, he told me to like stay away from a lot of caffeine, you know, all the stuff that will damage your kidneys more. He said just, you know, drink water. Water is your best thing to do, you know. So as far as drinking water, yeah, he was the guy who made me carry a flask. He was my main guy. Yeah, he always told me to, always have water with you. Drink when you're thirsty. Don't overdrink it. Don't overdrink. Just drink when you're thirsty. Because as a person who has CKD, you got to think like whatever you drink, it got to come out. Mm-hmm. And if it doesn't come out, then you got to get them back up, and then you can get sepsis, which you don't want, because you're gonna be back in the hospital again. So, I had so much worries of like, I was just taking like 2 sips an hour. I was so conscious about being aware of this drinking. Mm-hmm. And he brought my awareness to that, like, watch your intake of water, of fluid. Even though we need fluid, he made it a point where you can still drink, but just monitor how much you drink. Because if you're not putting out what you drink, then you're gonna get a backup, which is your kidneys will end up getting damaged more. So, yeah, he did give me a lot of information, as well as my PCP. He was happy with all the weight loss, but the symptoms that came after it, the damage that has already been done. So, but they gave me a lot of courage to keep going, because like you said, you can get affected pretty majorly as far as being depressed or having no motivation. I think is the worst thing for what you go through, and when it comes and hits you so suddenly. Mm-hmm. So,
how long was it between the time you first saw the nephrologist and you started dialysis?
The first time I saw him was in, I believe, 2015. Yeah, so it's been around, going on, about 5 years.
Almost 5 years.
Yeah.
And how long have you been on dialysis?
This July, it'll be 2 years.
2 years.
Yeah, 2 years.
So you had some time to prepare mentally.
Yeah, where it was like it had calmed down. That, like I said, that one time when it calmed down, then I had time to do the bariatric, and then that's when it came back again.
So when you started dialysis, did you start with a catheter, or were you able to start with the fistula?
From what I understand, everybody starts with a catheter, with a cat.
Right.
Because when they did my cat and the fistula at the same time.
Okay.
So the information I got was, this thing has to heal. It takes 3 months to get functional so I can use it, for blood flow. So I did the catheter first. I did it 3 months straight until this matured. It was kind of weird at first when they first put the fistula. Well, this too, the catheter, because you can feel that the line going through your chest, going straight, to your heart. You can feel that. Mm. And
that's weird.
Yeah, it is weird. And you had this thing sticking out like this. You got 2 cords sticking out like that. So yeah, it was pretty weird. And then when they did this one, when I came out and my fistula was already in, she made me put my hand right here, my finger, and you can feel it, the buzzing. You want to feel it?
Yeah.
So it's right here.
Oh, wow.
Yeah, that's my blood flow.
That's amazing.
That's the blood flow in your fistula.
Yeah.
So she said if you don't have that buzz, you need to go to the ER like quick.
Oh, right, because the blood's not flowing.
Yeah, they need to either check what's going on. Maybe you got a clot, or they gotta flush it out. They gotta clean it. But so far, thank God that I've been good this long with no clots.
And did you ever get an infection in the catheter?
I don't think so.
Okay.
Yeah, I never did. At the facility, they make sure they cover it really well. I saw it, and they're always cleaning it. Everything is like super clean at the facility. And as far as that, no, I don't think I got an infection.
I think you'd remember if you had.
And my surgeon, she was pretty adamant about me. She wanted to see me every month. Every month I had to go see her during the whole catheter thing.
Yeah.
So, and it was, it's kind of weird when she pulled it out because she gave me the okay to start with the fistula, and they don't put you to sleep.
They just yank
Yeah,
it out.
she just pulled it out slow. Like, so you feel like part of, you could feel it, like something being ripped out of you in a way.
Yeah,
Yeah. So it was kind of a weird feeling.
yeah.
Without no numbing. She didn't numb me at all. She just, you ready? I'm gonna tug on it. Tug, and then that was it. She tugged it out, and that was it. But it didn't bleed. She said, which is good.
Yeah,
There's no
really?
bleeding. So I was happy with that.
No kidding. Yeah.
Weird, but yeah, I'm glad everything went well with the gap and the fistula.
Yeah. Yeah, and I was saying before, the lesson I take is to get your tattoos on
Yeah,
your
if you're
good
planning
arm
getting
before,
tattoos, yes.
before you get the fistula
Yeah.
surgery.
They normally do your dominant arm, so I mean they try to leave your dominant arm, because then you can do a functional, but they'll take your other arm if needed. They started low at first, but I know some people, if this shuts down, they go way up.
Yeah.
Yeah, they start going above the elbow. So I'm glad that mine is still okay, it's still functional.
Definitely.
So they tell you to do a lot of exercises, which consists of a stress ball. So you would hold your arm up like a 45-degree angle, and then you like do this, and then you'd hold it for like 10 seconds. So you have to do that a lot, especially when this is maturing. You want it to mature good, so you don't have clots. Because if you have a clot, then you got to come back. And you don't want to come back the next day, and then that means you're gonna be back to back, you know.
Yeah.
And that's to me that's kind of hard, because I did that once. It did clot on me. So what to expect, you know?
And I assume eventually you get sick of medical facilities.
I do, but the techs they're so they make it where it's fun. You know, they talk to you. Oh, how's your day? Good. And you get to know them, on a
Sure.
personal basis, and you just become friends. You know.
That's cool.
So it's always good, and they're on. Some of them is like my age. You know, a lot of the techs are young guys. You know, I have male and female, and they're all awesome.
Well,
They're
that's
all
great to
awesome.
hear.
Yeah, they're good people. So they always make, going there not as serious, I guess you would say. They want to make sure the morale is good, like a good vibe in there.
That's important.
Yeah, because some people, I see people this is it. They have that, you can tell, I don't want to be here. Some of them, they don't come to treatment every day. You can who the regulars are once you've been there for a while, But yeah, the Texas to me is awesome where I'm at.
So when you first started dialysis, did you have any trouble getting assigned to shifts that were convenient for you?
At first, yeah, you're right, because they had me in the afternoon shift. So I would start for 4 and don't get out till maybe after 8, because my treatment was so long. It was 4 hours. So it would run the whole 4 hours, and from 8 to 4 hours on the machine. That's, to me, it took a lot out of me in the beginning, because you get so drained, because they're sucking all this this dirty blood, cleaning it and pushing it back into you. So either way you look at it, it's 4 hours is a long time. So you tend to you pick your favorite TV show, whatever's playing that that evening. Like Monday, Wednesday, Fridays is my days, and it still is. Unfortunately, I got to switch over to the morning shift, which works out a little bit better for me now. It started out slowly, like maybe one day I would come in the morning, and then I'll keep my 2 days in the afternoon. But then a good friend of mine, he had stroked out, and he had to go to the hospital, and he didn't make it, unfortunately. So they gave him his spot. So now I'm just completely 3 days a week in the morning. It's easier for me, by 10:30 I'm leaving, because I come in at my treatment is at 6, so I'm there by 5:45, waiting for them. But the techs are so good that they They make you come in early. You know, they hook you up, make sure everything's good, and then by 6 o'clock I'm on. You know, so it's decent coming in at a good shift in the morning. And then you can leave, and then you have some of the day where you can rest, and then you can still like do other things throughout the day.
Can you eat or drink while you're on dialysis?
They prefer you not, because it can affect your dialysis, you know, as well. Because if you eat something, that's why they tell you if you're gonna eat before you come, so your food can digest. Because if it's digesting, if you're eating and you're digesting at the same time, it can affect your dialysis time.
Oh, okay.
Yeah.
So you don't want to do that?
Yeah, you don't want to do that. You can choke. And I mean, the techs told me they saw people choke before eating while on dialysis. Not even drinking water is a good idea, they said. They said to wait when you're done, and then you can go eat and get something to drink. But yeah, it's kind of dangerous if you're going to eat during dialysis. Yeah, they recommend not. But people still do it. I still see people do it, you know.
Well, people do all sorts of stupid things, don't we?
Yeah. They got to flush it out. They got to clean it. But so far, you know, thank God that I've been good this long with no clots.
And did you ever get an infection in the catheter?
I don't think so.
Okay.
Yeah, I never did. At the facility, they make sure they cover it really well. I saw that, and they're always cleaning it. Everything is like super clean at the facility. And as far as that, no, I don't think I got an infection.
I think you'd remember if you had.
And my surgeon, she was pretty adamant about me. You know, she wanted to see me once a month. Every month I had to go see her during the whole catheter thing.
Yeah.
So, and it's kind of weird when she pulled it out, because she gave me the okay to start with the fistula, and they don't put you to sleep.
They just yank it out.
She just pulled it out slow. So you feel like you could feel it, like something being ripped out of you in a way.
Yeah.
Yeah. So it was kind of a weird feeling.
Yeah.
Without no numbing. She didn't numb me at all. She just, you ready? I'm gonna tug on it. Tug, and then that was it. She tugged it out, and that was it. But it didn't bleed, she said, which is good.
Yeah,
There's no bleeding. So I was happy with that.
No kidding, yeah.
Weird, but yeah, I'm glad everything went well with the gap and the fistula.
Yeah. Yeah, and I was saying before, the lesson I take is to get your tattoos on your good arm before
tattoos, yes.
before you get the fistula surgery.
They normally do your dominant arm, so I mean they try to leave your dominant arm, because then you can do a functional, but they'll take your other arm if needed. They started low at first, but I know some people, if this shuts down, they go way up.
Yeah.
Yeah, they start going above the elbow. So I'm glad that mine is still okay, it's still functional.
Definitely.
So they tell you to do a lot of exercises, which consists of a stress ball. So you would hold your arm up like a 45-degree angle, and then you like do this, and then you'd hold it for like 10 seconds. So you have to do that a lot, especially when this is maturing. You want it to mature good, so you don't have clots. Because if you have a clot, then you got to come back. And you don't want to come back the next day, and then that means you're gonna be back to back, you know.
Yeah.
And that's to me that's kind of hard, because I did that once. It did clot on me. So, what to expect, you know? And
I assume eventually you get sick of medical facilities.
I do, but the techs they're so they make it where it's fun. You know, they talk to you. Oh, how's your day? Good. And you get to know them on a personal basis, and they just become friends. You know.
That's cool.
So it's always good, and they're on. Some of them is like my age. You know, a lot of the techs are young guys. You know, I have male and female, and they're all awesome.
Well,
they're
that's
all
great
awesome.
to hear.
Yeah, they're good people. So they always make going there not as serious, I guess you would say. They want to make sure the morale is good, like a good vibe in there.
That's important.
Yeah, because some people I see people this is it. They have that, you can tell, like, I don't want to be here. Some of them, they don't come to treatment every day. You can just, who the regulars are once you've been there for a while, But yeah, the Texas to me is awesome where I'm at.
So when you first started dialysis, did you have any trouble getting assigned to shifts that were convenient for you?
At first, yeah, you're right, because they had me in the afternoon shift. So I would start for like 4 and don't get out till like maybe after 8, because my treatment was so long. It was 4 hours. So it would run the whole 4 hours, and from 8 to 4 hours on the machine. That's, to me, it took a lot out of me in the beginning, because you get so drained, because they're sucking all this thing, this dirty blood, cleaning it and pushing it back into you. So either way you look at it, it's 4 hours is a long time. So you tend to, like, you pick your favorite TV show, whatever's playing that that evening. Like Monday, Wednesday, Fridays is my days, and it still is. Unfortunately, I got to switch over to the morning shift, which works out a little bit better for me now. It started out slowly, like maybe one day I would come in the morning, and then I'll keep my 2 days in the afternoon. But then a good friend of mine, he had stroked out, and he had to go to the hospital, and he didn't make it, unfortunately. So they gave him his spot. So now I'm just completely 3 days a week in the morning. It's easier for me, by 10:30 I'm leaving, because I come in at my treatment is at like 6, so I'm there by like 5:45, waiting for them. But the techs are so good that they make you come in early, they hook you up, make sure everything's good, and then by 6 o'clock I'm on, So it's decent coming in at a good shift in the morning, because you can leave, and then you have some of the day we can rest, and then you can still like do other things throughout the day.
Can you eat or drink while you're on dialysis?
They prefer you not, because it can affect your dialysis, as well. Because if you eat something, that's why they tell you, if you're gonna eat before you come, so your food can digest. Because if you're eating and you're digesting at the same time, it can affect your dialysis time.
Oh, okay.
Yeah.
So you don't want to do that?
Yeah, you don't want to do that. You can choke. And the techs told me they saw people choke before eating while on dialysis. Not even drinking water is a good idea, they said. They said to wait when you're done, and then you can go eat and get something to drink. But yeah, it's kind of dangerous if you're going to eat during dialysis. Yeah, they recommend not. But people still do it. I still see people do it,
Well, people do all sorts of stupid things, don't we?
Yeah.
So it sounds like you were sort of automatically assigned to hemodialysis and didn't have an option for peritoneal dialysis?
No, actually, they did give me the option to do, PD at home. But I chose to do it at the facility with the HD. Only because I know how much goes into everything. Has to be sterile. Everything has to be clean. You cannot be messing around. You cannot be getting an infection. So when I heard the word infection, I was like, you know what? Maybe PD is not the way to go right now. So I just did the regular hemodialysis at the facility, because everything's already clean. And they're always using different gloves. Every time they touch you, they trash the old and put new gloves before they touch you again. So it's EC is the way to go right now. That's what I chose. Not like I wouldn't try PD, because I have an auntie who's on PD at her house. She does. So I'm aware of it, but it just didn't fit me at the time.
Yeah. Well, and it's tough enough, so you want to choose a method that
it works a
works
little
for
better.
you.
Yeah, exactly.
Yeah. Tell me about the time you first had dialysis. What happened? It
was kind of scary, because they're explaining what they're doing. The text is actually explaining what they're doing. And it was the catheter at first. So, they have their swabs, they're cleaning it off, they're hooking me up. And then they go, yeah, we're ready. Okay, I go, okay, go for it then. But you don't really feel it. But you can see it, along the tube going to the machine.
Yeah.
And they tell you what's going on. And at first it felt kind of weird. But it didn't affect me like how, I thought it would. Like I would feel like a pulling sensation of what they're pulling, but I didn't feel that. They even say like, sometimes you can get a headache from when they pull too fast, too much, too quick. I didn't get that type, everything went pretty smooth my first time around. But yeah, it went pretty smooth. I feel, blessed too that I didn't have any complications. So I feel blessed that, I'm doing good so far.
And so do you feel better when you finish dialysis?
Yeah. I feel a lot better. In my opinion, I feel a lot better. I just get so tired. I just sleep. When I go home, my wife just make sure I take a nap because, eventually you're gonna sleep anyway. Because of what you did went through for 4 hours. So, yeah, I do. I mean, it does affect you, but normally it's because you're just tired and hungry when you come out of dialysis. You gotta eat something. Like I said, you gotta watch your liquids, but eating is no problem. Just that I eat I can't even finish a kid's meal. My appetite has shrunk so much. So not only that, but it's a bariatric, that also is in play. But yeah, to answer your question, yeah, it went well. It's pretty good so far. Besides just taking a nap and getting something to eat is the main objective. I think a lot of patients do that. As soon as you're done, I'm gonna go get something to eat, go home, sleep, because that's what normally you do on the days. Is you just knock out, you just sleep for 4 hours, because they rate you on your weight when you go in. So like my weight they go by kilograms, so mine is 108.5. So you can do that. Now you take that number. So whatever you're over, you have to write it on a piece of paper and give it to the tech, and then they'll program the computer. And so for 4 hours, they're taking the volume of what's being sucked out is at 400. I don't know if you understand that, but the rate of how fast it's being taken out
right.
is at 400. I think it's like milliliters or whatever.
Probably.
And it's going, to me that's pretty fast at 400. That's a lot.
Yeah.
So you can imagine when you're done that when they push it back in, the clean blood, that you just get super tired. You just get overwhelmed, tired, but you don't want to eat, but you need to eat before you fall asleep. So so yeah, after a while you just get used to the routine of, okay, I gotta get something to eat. Now I gotta go home and just rest. So
yeah, it sounds like it does become the whole management of kidney failure becomes a routine that you
especially if you're on meds, especially if you're on meds. Like now, thank God I don't have all those meds I used to take before. I just have one medication that I take is for my blood pressure to keep it up or stabilize.
Wow.
Other than that, I just take supplements to help with my overall condition of my body. Because for a kidney patient, you can't eat too much dairy products, because phosphorus will ruin your kidneys as well. So you gotta, every time you eat, you have to take these binders to help control your phosphorus. So that's another medication too.
Yeah.
But that's only when you eat. So, it depends but everything has phosphorus in it, from what I gained from doing research.
Yeah.
There's a lot of stuff that, we eat that has natural phosphorus. So you're not going to win with that. But I'm just down to one med, which is, I'm glad.
That's great.
And there's a whole, I take supplements, just to keep my bones active or in good shape, because, without phosphorus, your bones will get weak. That's what I gathered through research.
Yeah. Yeah, you learn a lot more about your body, don't
Yeah,
you?
yeah, you do.
Now, one of the things I've heard is that before you go on dialysis, you want to eat a low protein diet, but after dialysis, you actually need to eat more protein.
Yeah, that is true. Because I guess during the process of being on the machine, it takes out a lot of protein when they get cleaned out and when they put it back in. So yeah, it gives you have this. They do monthly labs every beginning of the month, and you get it within that week. So if they do it on Monday, you'll probably see it on Wednesday. The dietitian will come around and tell you, oh, your phosphorus is high, or you get your cleaning is good, and then you have either happy faces or you have bad or sad faces if you're doing well. So we're all trying to aim for the happy faces, but it's sometimes hard to keep track of what you eat. That's like I said, natural phosphorus is in all the foods we eat, so it's like super hard, but yeah.
We've talked a little bit about diet, and you have had 2 disease processes.
Yes.
You've had to manage at the same time.
Oh yeah. More like 3, I think.
3?
Got the high blood pressure,
Oh, yeah.
the diabetes,
and the
kidney function.
So, what lessons have you taken from all those experiences?
I think the most I got out of it is to maintain your body, or to manage your body well, And if the doctor suggested something, I think you should follow his lead on that. If you're trying to get healthy, then do everything natural. That's what I think. Yeah, I mean, it's so hard to say because I've been through so lot for the last 5-6 years. I've been through a lot. So, yeah, this to, if you're gonna maintain your health, just follow through on what you're doing. Make sure you taking your meds. Follow the guidelines that your doctor gave you strict guidelines on. And I think you should come out on top if you do what you got to do.
So with all the dietary changes required to keep you healthy, I assume that affected your family as well.
Yeah, it did in the beginning because I was so conscious about what I was eating. And I knew that I have to make a difference for my children. So we was eating healthy as far as, watching the fat intake, or just making more vegetables when we make a lot of our dinners. Just being more health conscious of what type of meats we were using, adding more salad, more greens, more vegetables. This, because my kids are still growing, I feel I didn't want to take that away from them. And they've been with me through a lot. Because I have 5 children, so I have 4 daughters and 1 son. So being head of the household, because I'm old school, I help cook too. So I would try and make healthy dishes for them, so they wouldn't not have that same situation or problem that I grew up with.
So it sounds like their diet improved as well.
Yeah, over the years, over all that time span, especially when I was doing that that whole bariatric thing, I was bringing all information, sharing it with them.
Oh, that's great.
Yeah, I think that's what, my family, I wanted them to be knowing what I was going through, that maybe I can help with them, what maybe they might have problems with.
So, how do you feel about your dialysis now, after almost 2 years on dialysis?
I feel good. I know when I'm heavy, I can tell with my body if I did too much or I drank too much. I can tell the way I feel. And so in that dialysis, I grew to respect it and also accept it, because, it's helping you go through something that you cannot normally get through. So I think my dialysis, I accepted it, and sometimes I have fun with it, and I help the nurses when I go there. My wife helped me set up myself up, and then I put my own blood pressure sleeve on. I push the machine button because I know I've been there for so long. I push it myself, the standing, and you gotta sit down and take another blood pressure check. So I just help them with of getting myself situated. So, and they're okay with that, which I enjoy. So, yeah, I really, I think it's been helping me to stay healthy and more positive that I can still do something, with my life. My life is not done, and I have, my children and my wife to live for. Yeah. So, yeah, I love my dad. Especially my techs. Yeah, I love them all.
So is there anything else that you'd like to mention?
So for those of you who are on dialysis, I encourage you just to stay the course, do your best with your diet, watch your intake of your fluids, do take your meds, try and keep your mind off of what you're going through, stay positive for those who love you, and you get the love back, yeah, just stay positive. That's all I can say. I'm staying positive for my family, and I believe you folks can stay positive too. And that's what I have to say. Oh, and just so that you folks know that a support group is really important to have, whether it's family or relatives, or even if you go into a facility, see if they have a support group who can help you with what you're going through as far as education. If you need more education, more awareness, just to, see if you have a support group. So, just wanted to throw that out there.
Well, thank you so much for sharing your experience.
Oh, thank you for having me.
Okay.